do we have any big thoughts on the shingles vaccine? It was just kind of a generic question. I don't know what's going on situationally here. I assume shingles is typically seen in people, 50, 60 and older?
Yes, increased risk at 50.
Okay. And I know it's somehow related to chicken pox.
Mm-hmm.
It's like the same strain of virus or something?
Yeah. So shingles, herpes zoster is caused by the varicella zoster virus, which is chicken pox.
Got it.
So
if you had chicken pox as a child,
it remains dormant.
Yes, it goes dormant. That's the word. Yeah.
Okay. And so it can come back when you are older
with a vengeance.
Yeah.
It manifests very differently.
Yeah.
It has to do with stress, age. I don't know that we know the exact reasons why, but yeah, it comes back with a vengeance. The blisters, the pain, the tingling, that really bad nerve pain. And then what really can become problematic is that some of that pain can be long term.
Yeah.
Sometimes just a little rash for a while. Other times it's hideous pain and it can stay for a long time, be residual. And then also there's a tendency and a big fear and concern that it can attack the eye.
Oh, yeah. Yeah.
So that's really, if you want to talk about long-term health concerns, besides some discomfort, that's the major concern that you have.
So, and there is a vaccine that's effective?
Shingrix.
Ooh.
Yes. So Shingrix replaced Zostavax, which did work well for a number of years. And Shingrix is a two-step series. I think it's like upwards of 97% effective.
Wow.
After both shots.
Yeah.
So if you're willing to kind of take the hurt piece up front with a sore arm and, maybe feeling a little ill for a couple days, it's worth it when you're thinking about some of the things that Joe mentioned.
And we're not talking, as a 40-year-old man, this is not something I need to be concerned with right now. No. This is an older crowd.
Yeah, definitely. And I think now, obviously, the time we're in, people are very sensitive to vaccines more so than ever, and we certainly understand that to an extent. But something like this has been studied for a long time. It is an old-fashioned type of vaccine. Mm-hmm. It is, kind of more of a one-off. We're not talking about series of vaccines you're giving to infants. That can be unsettling to a lot of people. But now you're talking over 60. Kind of a one-off vaccine shot, not some huge series. And you're talking about something that can be extremely painful. And potentially if it gets in the eyes, it can be an absolute nightmare. So I think it's something for people over 60, over 65, I would recommend. Yeah.
Cool. Makes sense.
If this was like an overrated versus underrated segment, Shingrix would be massively underrated.